Okay. Um, Meeting is being live streamed. Yes, I understand. Thank you. Okay. Hey, we did it. We're live. All right.
Against all odds.
Yeah. What is it? Happy Thursday, everybody. Happy almost end of the work week. It almost feels like we're out of 2020, almost into 2021 at last. So we're so close. It is college audition prep crazy season right now. A lot of people have already filmed their pre-screens, the videos you have to submit before you get a callback. And then a lot of people are just starting out in the throes of all of this busyness happening and all this stress happening. It's really important that we keep our vocal health at front and center and not sacrifice it for a temporary moment of anxiety. And that is why I am so happy to be joined by Dr. Reena Gupta today. I could introduce her, but I wouldn't do her justice. Dr. Gupta, would you mind introducing yourself and telling us a little bit about you?
I would not. First of all, thank you for having me and thank you for joining me and us, whoever is in this audience, because I'm in the Zoom room, so I can't see. I'm going to assume it's full of happy people.
It is.
Perfect. As Drew mentioned, I'm Dr. Reena Gupta. I am a laryngologist. I am the owner of the Center for Vocal Health in Beverly Hills, California. I've been a practicing laryngologist for over 10 years, moved out here from New York to start the practice. And I'm just happy to be here and help however I can.
Excellent. Well, we have a lot of questions that I have written that have been inspired by students in the past. So can you break down for us, first you said the word laryngologist, which I feel like is a word that not a lot of people have heard, but can figure it out pretty quickly. But can you describe the difference between an ENT and a laryngologist?
I absolutely can. And I love that that's your question because it is a soapbox issue for me. Yeah. ENT is ear, nose, and throat, right? For singers, the ideal physician to take care of your voice is a laryngologist. ENTs are physicians who have finished medical school and done 5 years of training in all of ear, nose, and throat. That is a requirement. I did it too. After ear, nose, and throat training, you can elect and apply for a fellowship. Fellowship is additional training. So I elected to do a fellowship and applied and got into a 1-year fellowship where I just learned voice, airway, swallow. Those are the functions of the larynx. And so laryngology, study of the larynx, is a year intensive in diagnostics, surgery, evaluation, and treatment of disorders that affect the larynx. So within ENT, yeah, you can do fellowships in all the ears, the nose, the throat, and there's several other fellowships that you can complete. The reason it matters is that in that extra year, you're really refining and expanding upon the little bit of knowledge that you gained in your 5 years of ENT training. Because even though it's 5 years, laryngology kind of gets the short shrift in training. You don't get as much laryngology in those 5 years and really even less of professional voice. It's inconsistent. And it's why the quality of care of an ENT is usually not the same at the same level as what you get with a laryngologist. And I would say 5 years ago, it was probably harder to find a laryngologist, but since then we've churned out a bunch. So I would say most major medical centers have one. There's a lot of us who are in private practice, myself included. So we are more around than we used to be.
I am personally curious because my partner is just finishing up her 3-year SLP program. And I hear her, she's also a vocalist. So I hear her talk a lot about, the anatomy that she's studying. First of all, she's also like, yeah, there's like nothing in here about the voice. It's almost all swallowing, and it's helping kids with like their speech issues. Can you sort of explain to me the difference? Because I know a lot of kids want to do theater for undergrad and then grad school, maybe go into teaching SLP. The difference between an SLP and an ENT, can you do that?
Absolutely. Cool. So first of all, I think that the parallels are very, very apropos. You can get your master's just like you can get your medical degree. You study your 3 years of speech language pathology just like you do your 5 years of ENT, and you're going to get a broad swath of all topics that those specialists treat. Fellowships in laryngology exist just like clinical fellowships exist for SLPs, and you can get a voice related or voice specific clinical fellowship as a rehab specialist. So what a speech pathologist is, they really are involved in the rehabilitation of the injured language apparatus, be it stroke patients, like you said, children with articulation, lisps and things like that, and then voice. So they cover all of that unless you've done a clinical fellowship that really is voice focused. And then your goal is to rehabilitate voice. So I might find a singer has nodules, and so I will refer to the speech pathologist. Just like you have a physical therapist for sports injury, you have a speech therapist and a voice therapist for vocal injury.
Got it. Okay, well that makes a lot of sense. We have, so it is September. The auditions in person start as early as November. They really heat up in January and February. So students are going to be traveling an awful lot at auditions across the country, often multiple trips. So first of all, air travel sucks for a singer, and then you're doing all these different auditions. What are some ways that students can keep their voice healthy during all that travel and all that work?
I'm going to turn it back to you for a second because I want to ask you to just flesh out a typical day of audition. So like you land, and what does that day look like?
So you land, let's say you go from California to New York City, and then you probably go see a Broadway show because it's your first night in the city. And then the next day you start around 7:30 in the morning, and then you audition until 5 or 6 o'clock, and you fit in as many auditions as you can. So it's not unusual to hit a dozen schools in one day.
And how long is one of those auditions?
2 sets of 32 bars, and then an interview, 3 or 4 minutes.
And what are you doing between all of those? Like school 1 and school 2, do you do anything between to like learn about other schools? Are there?
Maybe you have a dance call, maybe you have time for lunch. Maybe you're working with me to warm up your acting muscles for your next audition. But typically there's really not a lot of downtime, especially students who are with me, because we have this finite window to cash in on as many schools as we can without traveling to all of them, maximize scholarship dollars, see a bunch of schools that maybe you didn't even apply for, just drop in and say, hey, I'm here to audition for your school. So, it sort of depends. If they're being pushed around, as many schools as we can fit in today,
And the reason I ask is it sort of then becomes a predictor of the trouble you're going to have. So number one, you cited one is air travel. So air travel is very dehydrating. So right out of the gate, being aggressive about hydration. That doesn't mean when you land. It means for the 2 weeks before you even fly out in the first place. Oh. Your vocal fold hydration level reflects your hydration for the previous 2 weeks, not the previous 2 minutes. So what you want to do is preload so you get as much hydration into that vocal fold tissue as possible. And then you're trying to maintain. So I know it's annoying to go to the bathroom on the plane, get an aisle seat and really aggressively hydrate, because you want to land as hydrated as possible. And that recirculated air is drying. Yes. So you've landed, you are exhausted. And so rather than sleeping, you are catching a show. I might, as passionate and as in love as I am with Broadway, argue for a good night's rest, because the 7:30 arrival time is cruel, even for me as a surgeon. So might I suggest going to New York as a separate trip for catching shows? Because what you're also doing every moment that you're doing all those other activities is you're engaging in social voice use most of the time, right? You're going to be talking before and during intermission and after, and you're not going to be rested. Then you're going to go into a hotel room where the air or the heat is on, which is drying. So traveling with a humidifier, even like those, they're kind of bulky, but the ones that you plug into a room, and just keeping that going at night is going to help you to wake up with a more moisturized vocal tract. Then implementing vocal rest as much as possible during that 12 school day. And I know that is somewhat contradictory to what the schedule you just outlined is,
Sure.
but I am positive that there are periods of time that you could rest your voice, even if it is a quick phone call, a chat over lunch, some of the social stuff that we tend to do because you're seeing people that you want to meet or friends, or you're with people. Trying to reduce the voice use is really, really important. And then the final tip I will give is if you think about voice use as getting more and more strenuous as the day goes on, because you are getting more and more fatigued, what'll happen is, just like any physical activity, you're going to get less and less efficient. Right. So if I'm a runner, my first race, I'm in perfect form. And as my major movers get tired, I'm going to start to kick in some minor movers, right? I'm going to use some of what we call compensatory muscles. And that gets you to be less efficient, and then it builds upon itself. So if you're familiar at all with the technique of straw phonation or semi-occluded vocal tract exercises, their goal is to restore you to maximal efficiency for where your cords are at in that moment. So as you're swelling, because you are going to swell over the course of a day, you reset with the straw, and you are then maximally efficient for that version of your vocal cords. Fast forward to the next audition, a quick pitch glide on a straw, and you're maximally set for that one. Wow. So doing a little kick on the straw, and that's why I love the straw kits, because they come with the different sizes and shapes and lengths that you need as you fatigue. You stick it in your pocket. I like the voice straw the best because it comes with this wicked cup system as well that allows you to train in articulation. It's a whole nother conversation, but doing that throughout the day. And also, finally, I would say be attentive to where you're headed. Because if your allergies would kick up there at that time of year, or if you're unsure, kind of assessing for, how does my nose feel? Am I feeling congested? And pre-treating, getting your laryngologist to kind of help you anticipate what you might run into is going to really save you, because that's race day, right? That's when you want to have every single thing working in your favor.
Is there a difference between drinking regular tap water, filtered smart water versus bubbly water? Does the carbonic acid have any like detriment?
Yes and no. If you are somebody for whom like carbonated beverages make you a little belchy and refluxy, then I would avoid them because it's a known reflux trigger. But if it doesn't do that to you, then rock on with whatever, as long as it's hydrating. And I don't care if it's tea with honey or, straight water, it's all the same.
Does coffee counteract the effects of water? I
hate this question because I am obsessive about coffee. And so I have to like not practice what I preach. I would say this would not be the time to have like a second cup. Is like in the middle of one of these days. What we feel is that it's probably a break even. You drink a cup, you probably pee that extra cup back out. So then you just want to rehydrate afterwards.
Got it.
Half is another good idea. It's another good way to kind of not rob yourself of necessary hydration.
And by the way, I was in my local bodega yesterday, and Folgers makes half-calf coffee now. It's made like for you in the store. I can't say enough about it. It's great.
Yeah, they got our number. They know you singers are trying to do the right thing. So they're like, we will make a product for you.
There has been, at least I have observed, voice teachers saying, vocal fry is the best warm up, and other voice teachers being like, no, you're killing your vocal cords. Can you set us straight on that?
No, but thanks for asking. Next question. It's like any exercise, right? Some are going to work really well for some people and really poorly for others. So it really takes, you can't be dogmatic about any of these exercises except for semi-occluded. I feel like that works for almost everyone, the straw stuff. But fry, some people find to be really strenuous and others beneficial. So the goal is not to find out on audition day. You're working with your coach leading up to it, and then what works for your voice. There's no right or objective wrong answer there.
Got it. Okay, well, that makes sense. belting. Is belting always hard on the voice? Is there a healthy way to belt, or are there simply healthier ways to belt?
Oof. So I will say that we're like creeping a little bit out of my turf. So I'm going to give you
Okay.
the medical answer.
Okay.
And then when everybody who teaches voice like piles on me, I'm going to just direct them to you. Is that a deal?
Okay.
All right. So it is medically thought to be a very, very strenuous form of voice use, right? It is the higher and louder you get, and the more you're pushing volume and pushing that sort of belt configuration into higher and higher notes, the higher risk it is. That's why the voice breaks more easily as it gets into those higher notes. So
Got it.
it is absolutely less, the least strenuous is obviously going into head voice, falsetto, call it what you will, and then mix and then belt in that order. But used appropriately, there are ways to do the balance. And it's not like every MT student and singer is injured, right? So we know that there's a way, but it does take also ensuring your vocal health is 200%, right? Ensuring that you're implementing rest, technique, managing your allergies, not dealing with reflux, not smoking, not vaping. You know, you have to think of the voice as not just a motor task, but rather an environment. And if you do everything right in that environment, you're going to tolerate strenuous activity more easily.
That I hadn't thought about smoking and vaping. Like it's crazy how many singers I've known who smoke. It just blows my mind.
Well, you know, I'll say the thing now is actually like vaping is perceived to be the safer alternative. And so it's tough because you're not getting that same clear smoke. You're not seeing the smoke, so you do feel like you're safer. It doesn't appear to be the case. It does look like they're comparably impactful in a negative way. Everything you inhale passes your cords, and your cords want clean air. Secondarily, everything you inhale goes into your lungs, and your lungs also want clean air, right? Just think about what it feels like when you breathe in like perfume and you get kind of like a little choky and sputtery because your lungs react to those oils that are in the perfume. And that's what you're inhaling with the vape. It's an oil-based vape juice, basically. And so we already know that the lungs are unhappy, but the odds are very high that the larynx is too. So my preference is to avoid all of it. And, you know, I'm variably successful at convincing people to do so. I understand all the social elements, we'll say.
You know, and this actually got brought up by Caitlin Hopkins, who runs the MT program at Texas State. She is adamantly also against, as a singer, inhaling anything that's on fire, which makes sense. But, you know, and, you know, we were talking about the fact that there are some students who benefit from the use of cannabinoids. But what do you call them? Edibles are certainly suitable compared to inhaling vape or leaf or something.
Yeah, exactly. And people kind of get on me about like, what if I use this product to inhale it or this one? And I've had every pot paraphernalia in my office where people are trying to like be like, this one is safe. And the truth is this: number one, we're not going to study them all. So I'm not going to prove to you or disprove to you that it's safe. The manufacturers also haven't done the work, right? So don't believe the hype, but it's not even a temperature thing. Some people decide that because it's cool, it's better for you. The larynx is really good at regulating temperature. It's why it's hard to swallow something that's really hot, because by the time it gets down there, your body knows that the tissues lower down don't like extreme temperatures. So it's not the temperature of what you're inhaling, it's the literal particulate in it that's a problem. That's why pollution irritates your nose, sinuses, lungs, and voice. Your vocal cords are part of your respiratory tract and close to your digestive tract. So if something would bother your lungs or your nose or your sinuses, they're bothering your voice too.
Oh, take that, everybody. If it's bothering your nose, your sinuses, your digestive tract, or your lungs, it's also bothering your larynx. Boy, I want to pin that. That is really,
Yeah.
really good. Um, we actually have a question from Michelle Scraggs. This is funny. I can't believe she's asking this. What are your thoughts on dairy? Yes, we were joking about that
Only on
before the
pizza.
interview.
Only on pizza. You're killing me that you're in New York. That's my home turf. And I think I eat pizza like 6 meals a day while I'm there to catch up
Yeah,
before
totally.
I get back to LA. Pizza and bagels, that's it. I am gonna light a little fire here. It doesn't bother me. I don't ever tell my
Yeah,
patients to come off dairy.
sure.
It is mucogenic. There is no question that temporarily when you consume dairy, especially like straight dairy, like milk, you will get more mucus in that moment. So again, do I advise doing that right before the audition, like an hour before? No.
Yeah,
Do you need to eliminate it? It's not been found to be necessary. If you are lactose intolerant, allergic to dairy, different story,
yeah,
but fewer people are than think they are allergic. More people are than think they are lactose intolerant, but that doesn't really bother your voice. It just makes lower digestion a little bit
right,
problematic.
right.
Um, I haven't found any need to eliminate dairy in my patients.
Good news, Amy. Woohoo!
Ice cream for
Um,
everyone.
that's right. Hey, you talked about scoping a little while ago. Can you explain what scoping is,
Yes.
and then tell us the benefits of scoping um, for like the average singer? I think people think it's sort of like a only in dire circumstances. You know what I mean?
Yeah, and that's like the thing I disagree with the most. So,
Right.
my sort of way of framing this is think of yourself as an athlete. Let's stop thinking about singing as art only. Your sport is art. Your sport is vocal arts, but you are an athlete. And the reason that matters is if you were any other type of athlete, if you were a football player, would you only go to get checked out when you are in pain or you've hurt something? Or do you get an annual physical? Do you get cleared for sports? Do you get evaluated every time there's anything, right? So the singer has been at such a disservice because we don't experience pain. We don't experience the same kinds of physical manifestations of problems that sports athletes do.
Right.
And so we sort of neglect to realize that hoarseness, loss of range, voice fatigue are our equivalent of sports injuries, right? So that's when you want to sort of reframe how you think about what you do and realize that your whole body is contributing to your performance of that sport. So, what an annual vocal physical should look like is a surveillance of your entire physical health, just like any other sport: heart, lungs, ear, nose, throat. And that's sort of quick and easy to do when you're younger. And it just becomes more and more important as we age because
Sure.
stuff happens, right? So, after that general whole body check, then what I do is I will always scope my patients. And
Yeah.
I recommend an annual exam for sure. I see a lot of my kids before exactly this time. Before, like in October, is very busy for me for this reason. Everyone's getting ready to go out for auditions,
Yeah.
pre and post tours. All of these like really intense periods. I want to see you around those, just like any other athlete. So there's grossly two kinds of scopes. There's the one that goes in your nose and the one that goes in your mouth, right?
Okay.
The one that goes in your nose is the one that's performed the most commonly. It is the one we learn in ENT residency in those 5 years of training. Every ENT knows how to do it, and it does achieve the goal of looking at your vocal cords. It's what we call a flexible, because the camera has to be flexible to go in through your nose and down to your cords.
Sure.
Flexible laryngoscopy, looking at the larynx with the camera that's bendy. Okay. The advantage of that is that everybody has one, every ENT has one. So you'll always get a look at your cords. Another advantage of it, I will say, is that it helps you to assess muscular issues. So if somebody is partially paralyzed or there's some muscular thing going on, flexible laryngoscopy in the nose, aces. Downside is because it's smaller, it carries less light, it's more poorly resolved, so less detail. And not commonly do people use a strobe light. So it's not common to use a strobe light with the scope that goes in your nose. The reason that matters is this: your vocal cords don't just function by opening and closing, they function by vibrating. And the vibration is too fast for our eye to see. with a strobe light, what we're actually doing, just like a strobe light at a party, you're slowing down the vibration, or you're sort of giving the impression of a slowed down vibration so that you can assess the vibration, right? So that's where we use the scope in the mouth, and we call it a stroboscopy, strobeoscopy, right?
Yeah.
And the idea there is we're looking at a much larger camera. It's totally painless. It looks at the vocal cords directly with more resolution, illumination, but most critically, vibration. So that's how I'm detecting tiny injuries, blood vessels that are an issue, pre injuries. By the time I can see it with the nasal scope, even with my eye, we're several phases beyond where I want to catch it. So the scope in the mouth is the way to go. It's also called laryngoscopy because that just means looking at the larynx, so it can be confusing. But remembering that it's a strobe and it goes in your mouth is kind of going to get you most of the time actually also to a laryngologist, because it's only really us that invests in that kind of technology.
I can share a personal anecdote here. Dr. Gupta did my rehab from my, I'm gonna get this wrong, laryngoscopy? When I got polyps off my vocal fold. It's called a laryngoscopy, is that right?
It's also, this is why medicine sucks. We call everything, our semantics are the worst. It is also called a micro direct laryngoscopy because we are still looking at your cords, but we're removing something. So there's usually like a removal of a polyp or a removal of a thing.
That makes sense. So my ENT did the flexible scoping, and in recovery, you did the hard scoping through the mouth and found stuff that he was not able to see. Luckily, it was all good news. It was all, oh, you're even more healed than he thought you were. That was really good. If we're talking about pre-injury, let's say that I have had some injuries to my vocal folds. What can I do based on the severity of the injury?
So we have to find out what is going on and why, right? Are you predisposed to injury because there's an uncontrolled medical problem? And that's like 99% of the time. It's allergies, reflux, inflammation from smoking, autoimmune conditions, thyroid issues. There's a million reasons the larynx goes sideways. And that then means that tasking is harder and more fraught, right? So looking at it and identifying what your risk factors are. And then if I am seeing something that looks like there's inordinate forces being applied, you're scarring, you're stiffening, there's pre-nodules, then we're going to figure out what's your demand look like, how are you doing it, and what do we need to adjust?
Okay. If I'm in the pre-injury phase, let's say that it's looking like I have some damage, am I able to recover without surgery?
Most of the time, yes. It depends on what that pre-injury is. There's like pre-nodules that often do require surgery, but like inflammatory kind of stiffness doesn't need surgery, but unfortunately is irreversible. So that's why you want to catch it before even that sets in. And that's what those checks before demand is high. Like I like to see my young singers, freshman year, sophomore year, junior year, see me every year because your voice is also maturing. And so there's going to be so many changes that come with that if we can guide you through that safely, you're going to do so much better.
Every time I talk with you, I learn so much more.
Good.
And I also relearn everything that I learned from the year before too.
Takes us a year for a reason.
I would love for people to find out more about what you talk about and what you share. How can the people find you should you wish to be found?
I do wish to be found. Then there's a million ways, and that's how you know I wish to be found. So website, centerforvocalhealth.com. You can always drop an inquiry there. I'm reasonably active on Instagram, Rena Gupta MD. Literally yesterday, I was forced to join TikTok. And
yay, you'll love it. You'll never go back. It's the greatest.
It took me an hour to make one video, but shockingly, the handle Voice Doctor wasn't taken. So it is
kidding.
now. I am Voice Doctor on TikTok. And my intention is to add educational material there. It's not going to be me dancing. I know you're disappointed, but it's going to be educational. But I know. But the thing that I'm really, really most proud of from an educational standpoint is an organization I started with my partner, Mindy Pack, called the Savara Project, SVARA. And we do conferences and forums regularly, twice a year, big conferences and monthly forums, where we really provide incredible access to these speakers from all over the world on vocal health, singing, training, rehab, all the topics. And we have our singing summit coming up in October, October 21st, 2nd, and 3rd. And it is 3 immersive, crazy days. The first day is all vocal health, surgery, rehab, ear health, cardiovascular health, like everything. Day 2 is all like business of voice, reading a contract, marketing yourself, SEO for voicing, for singers,
Cool.
Mental health, neurodivergence in voice, how to teach and learn as a neurodivergent patient, client, person. Day 3 is all artistry, background vocals, arrangements, acoustic flips. I mean, it's just a silly conglomeration of everything you need to know to be a successful and healthy singer.
Okay, give me those dates one more time.
October 21st, 22nd, and 23rd.
Okay.
And you can find information. I actually extended, I think accidentally, I haven't deactivated the early bird yet. So if you pop through, don't tell, you can still get 30% off. It was supposed to be gone yesterday. But if you go to the Savara Project, either on Facebook or Instagram, or the website savaraproject.com, you will see the Singer Summit. It's also all over my socials. It's again, hard not to find. That's our goal.
Cool. Oh, that's great. And that's going to be in LA?
It's going to be virtual.
Whoa, so anyone can go.
Yes, and it's pre-recorded, except for the live Q&As. So what's nice is that if you're going to miss some of the content, it's Thursday, Friday, Saturday, you go to work, perhaps you can catch up that evening and you have a whole extra week to catch up. So if you're in a different time zone, like we have people attending from Thailand and Australia, because time zones are a thing.
Right. Cool. Is there any other places that I should direct the people to go to? Did you have any books out that you want to talk about?
Oh gosh, not yet. I'm rewriting the book that I wrote, and it's basically it's a primer for the vocal athlete, really directed to you, the user, rather than at the physician level. So it's going to be really accessible and understandable. And version 1.0 certainly was, it did really well. So I'm just doing a full revamp, but I'll have videos and pictures and the whole 9. So I will certainly let you know when it comes out.
Oh, that is so cool. That is so cool. Thank you again so much for joining us. I will direct any questions you have for Dr. Gupta. You can either message her on TikTok because she's there now, or just leave a comment for me and I will get the answer for you. Again, so much thanks for joining us, and we will be in touch soon.
Thank you so much. I loved it.
Thank you. Bye-bye.
Bye.